Corps.
All right. Well, I don't have the minutes itinerary in front of me, which is okay because I don't need that. Because I never give anyone any time to talk about themselves. I see who we have here today. It's Raymond. It does. It's a small crew today. That's fun. But all right.
Well, Jim doesn't know who we are. Introduce ourselves.
That's what I'm saying. We'll just start with the introduction. I think Raymond's driving right. Raymond, can you give a quick 30 seconds who you are?
I'm on my way to Simi Valley. At our food drive, the Simi Valley Masonic Lodge brought several £100 and donated $300 cash. So I'm going to their business meeting tonight to thank them. And so I've just dropped down out of the Santa Susana Pass on my way to Simi Valley.
Wonderful. And Raymond Foster is? Well, Jim actually knows who Raymond Foster is. That's okay. Bella, hit it.
I'm Bella Foster. I'm the secretary of the Satellite Rotary Club of Military Family Support. Second year Rotarian, second year secretary.
Wonderful. My name is Dominic Torres. So people like to pop in as they do as the day goes on. We have I'm gonna say it, Jim Zenner. That's not, am I right? Close?
Yep, right on.
Close, fantastic. Perfect. We can just jump right in. I never like to read your guys' itineraries. I always just say, here's what we're doing, this is who you are. So, or I'm sorry, your biographies. So with that said, sir, go right ahead.
Right on. Well, thank you very much for having me tonight. My name is Jim Zenner. I'm the director of LA County Department of Military Veteran Affairs, also a Army veteran and a licensed clinical social worker. And so what I do and what our department does is outreach and engage with veterans, their dependents, active military, reserve National Guard, and work on getting veterans and their dependents connected to the benefits that they've earned. We have about 32 veteran service officers. The vast majority are veterans themselves. We're what you call accredited veteran service officers. So we're accredited through the state, who's accredited through the Veterans Administration. And what we're accredited to do is really file claims on behalf of veterans and their dependents for benefits. There's a variety of benefits that veterans have earned through their service, and their family members as a result have earned through their family member service, their veteran family member service. And just a brief overview for veterans that served in the military and incurred injuries. There's what's called a service-connected disability payment. And so you can get rated at 0% service-connected, meaning the VA recognizes that you have a condition as a result of your military service, but it doesn't really affect your functioning, all the way to 100% service connection, which is can be in two different categories. You can be 100% total and permanent, which allows you to continue to work, or you could be just 100% individual unemployability, which you cannot work over a certain amount. Otherwise, the VA recoups the money that they paid you. And it's in increments of 10. So there's a 10%, 20%, all the way up to 100. VA math, it's kind of interesting. There is a math specific to the VA. So if you're rated 30% for one thing and 10% for another, you think, oh, that's 40%. How it works is the highest percentage that you get, you deduct that from 100. And so if you're 30, that's 70% that's left. And then they take the 10% of what's left. So it'd be 37%. And the VA rounds up. So if you're 35, you get paid like you're at 40%. So that's a service-connected disability. You also get additional money if you have a spouse, partner, or children, or dependent parents. So if you have a spouse and two kids, you get more money for that. If you have a spouse and two dependent parents that live with you, you get additional money to take care of them as well. So that's that's service-connected disability. There's also a non-service connected pension. So if a veteran served in a war zone and didn't necessarily come back with any disabilities or anything service connected, but they don't have any money, or their income is really low, they can file, we can help them file for what's called a non-service connected pension, which is about $1,400 a month. We could also file for what's called DIC. So since I'm service connected with the VA, for different conditions, if when I pass away, if my wife outlives me, if I die due to a service connected disability, so say that I am rated for hypertension with the VA, I pass away due to congestive heart failure, my wife can file for DIC and get a monthly payment as a result of my death being related to a service connected disability as a result of my military service. And that's close to about $1,600 a month. So that's another thing that we can do and file on behalf of dependents of veterans. We also can help veterans navigate their educational benefits. So file for the Montgomery GI or the post 9/11 GI Bill. There's also Chapter 35. So if you're a 100% service connected veteran, your spouse and kids can get paid to go through school. It's called Chapter 35. We can help process that. So that's something that we could do. Basically, being accredited reps means that the VA recognizes us as authorized representatives to represent veterans and their families on behalf of the VA. So that gives us certain access to VA databases and training and things like that. Being a veteran service officer, it requires a lot of, so you might have heard about the PACT Act a couple of years ago. There's a lot of stuff in the news. That was the biggest expansion of veteran benefits since World War II. And so with the PACT Act and implementing that, there's a lot of constant changes. And so part of our accreditation as veteran service officers is we have to attend 3 different conferences per year that the state puts on to learn updates, to drill down on basics, all that kind of stuff. So it's not just a one time you pass the test and you're good. We have ongoing CEUs, continuing education units, that we have to do to stay up to date, so that we're trained extremely well so that we don't mess up applications for veterans and their family members. And one thing you'll hear the VA say all the time, just go file your claim. Well, the problem with that is the average veteran or family member doesn't understand all the nuances around filing for benefits. And so things like secondary conditions. So if you have post-traumatic stress and you also have jaw issues, TMJ, TMJ can be secondary to PTSD. So if you have a diagnosis of PTSD, as a result of the PTSD, you have like TMJ. So you have that real tenseness in your jaw, the pain that's in your jawline because you're always clenching your jaw, or you're grinding your teeth at night. And so, filing for your claim, I mean, most veterans don't know that there's secondary conditions. So say you got an injury to your right knee, and as a result, you're overcompensating on your left leg, and you develop a condition in your left hip because you're compensating because of the injury to your right knee. That's a secondary claim as well. And so it's very nuanced. So what I tell everybody is friends don't let friends file their own claims because you just don't know. That's not possible to know everything. Like, we get paid to do this day in and day out. Our reps meet with veterans and their family members, talk to them, do these continuing education events. We also do like office hours where we bring our advanced VSOs in to kind of mentor our newer VSOs. So we're constantly training, we're constantly learning. If we're interviewing a veteran or a family member and we're not sure of something, we train our reps to use like the Microsoft Teams. It's like an instant message to send a message out to the entire team to see if they can get an answer real time as they're sitting there working with a family member. And so the big takeaway is that it's not simply just filling out a form and you're good. The more you know, the more information you have, the more able the more able you are to file the claim correctly and maximize it. And, a lot of veterans say, well, I came back with all my limbs and all my legs, I'm fine, save it for the next person. But honestly, like, you're just leaving money on the table. You're also, so in addition to your federal benefits, you've actually earned benefits at the state level. And so this is how I get a lot of veterans in, is I tell them like, hey, what if I go and tell your spouse that because you don't want to come in and see me, you guys are going to be paying for the tuition, or your kid's going to be paying for your full tuition when you can go to school for free. And so they're like, yeah, they don't want to do it for themselves, but when you're like, what would your spouse say if she knew or he knew that your kids could be going to school for free? You just don't want to come in and file for compensation. And so, often, and part of military culture is just we don't do stuff for ourselves. It's all about the mission. It's all about the people to our left and our right. And so, just being mostly veterans ourselves, we learn ways to kind of work around that stigma, work away around that stoicism that a lot of veterans have, and get veterans to come in. But talking about state benefits, so that what I reference is what's called the CalVet fee waiver. So CalVet is the state Department of Veteran Affairs. We got the federal Department of Veteran Affairs, which is broken down into VHA, healthcare, VBA benefits, NCA, which is a cemetery. And then every state has a state Department of Veteran Affairs. And so for California, it's called CalVet. CalVet has the tuition fee waiver. So if you're 0% service connected or higher, your kids can go to school for free at any UC or Cal State or community college. And in some cases, your spouse or partner can go to school for free. It depends. That one, I think that's called Plan B, and that gets into like your income. If you make too much money, then you're not eligible for Plan B. But that's probably the most popular state benefit. There's also the VA home loan that I'm sure a lot of people have heard about. There's also a CalVet home loan. And so sometimes the CalVet home loan is a better fit than the federal VA loan. And so we connect a lot of veterans and family members to CalVet to kind of talk through what are the benefits of the VA home loan and what are the benefits of CalVet, and help give them all the information so they can make the best decision for them and their family when purchasing a home. Another piece with CalVet is you can get veteran put on your driver's license. You just have to come see one of our reps across LA County, and basically we give you the form, we fill it out and stamp it. All you have to do is bring in your DD-214 showing that you served, and we can make all that happen. Then you just take that form to the DMV and you can get veteran on your driver's license. And just full transparency, and to be honest, like, it doesn't really kind of give you any real benefit for the most part. Instead of lugging around your DD-214 on Veterans Day, you can just have your driver's license that says veteran, so you can get your 10% Home Depot discount or your free pizza at California Pizza Kitchen on Veterans Day, just showing your ID. I'm personally working with the county to kind of get some special discounts if you have veteran on your driver's license for like our Parks and Rec, Beaches and Harbor, our Natural History Museum, places that veterans might want to take their families, and see if we can discount or actually get free admission and parking for some of that stuff to give the veteran status on your license a little bit more value. Also, there's some legislation at the state where if you have veterans on your driver's license, if the legislation passes, veterans would get 75% discount on lane sharing, purchasing lane sharing packages. So the state's like looking into options to actually bring some value to coming in and seeing us to get veteran on your driver's license. And really, what the state's kind of strategy behind that is really, if they're coming in and talking to a veteran service officer like myself about getting their driver's license, that's an opportunity for me to talk to them about the CalVet fee waiver, to talk about service connection, to really kind of, hopefully they have time to kind of sit down and talk with their veteran service officer that's helping them with that DMV form to get the veteran status. So yeah, just pulling up the curtains, giving you a peek behind the scene. That's the intent behind that veteran on your driver's license piece. Those are kind of the benefit side. We veterans that come in sometimes and see us, they don't have, they're looking for employment or they're looking for housing. And so we have partnerships with nonprofits that do employment and things like that. being one of 38 county departments, my job as the director is really to maximize everything that LA County has to offer for a veteran community. And so a lot of our veterans are aging. And so we've been working with our Department of Aging and Disability to really work on a two-way referral process to help connect veterans to the benefits that I talked about. There's also some additional benefits through the VA. If you have parents who are veterans that are older that need extra care in their homes, or if you yourself are a veteran that need in-home care support, there is a benefit called aid in attendance that can help pay for that in-home health care. And so, we're looking to partner with Aging and Disability to make sure that our veterans that intersect with our Aging and Disability Department and the different senior centers across LA County know about what we can do, and give them an option to opt in to talk to one of the veteran service officers here in LA County. Really, another big piece of our job is partnering with the Veterans Administration on things around homelessness, suicide prevention. Homelessness is important because the county is part of the continuum of care, and every VA relies on the continuum of care in their community to really case conference and get veterans housed. And so it's not just the VA out there housing everybody. They work closely with whatever continuum of care they're in. So in LA County, that COC is LASA. And so because LASA is a joint power authority between the county and the city, we get involved and make sure that we're being the best partners we can possibly be to the VA to get veterans housed. And so sometimes it's LASA outreach workers running into veterans. Sometimes it's Department of Health Services running into veterans. And my job is to really make sure that they understand how to connect those veterans to the VA and to the work that's veteran specific to get them plugged in. We also do work specifically with our Department of Public Social Services. That's where you can go and get your CalFresh, your food stamps, your TANF. Those are really for our super low income residents in LA County. And so there's a program when they come in, we ask them if they're a veteran or not. If they're a veteran, we get a referral over to my department to see if, in addition to food stamps and that kind of stuff, if we can possibly get them connected to some much higher benefits through the Veterans Administration. So that's really kind of like in a 15-minute spiel. That's kind of what I do and what we do as a county department for veteran community in LA County, and love to take any questions you have. Or
I just wanted to take a moment to say thank you for joining the Rotary Club. I know that you're our newest member, and I think that's a good connection for us to have with having you on the team.
Yeah, 100%. I got the invoice to pay the bill. I just don't know how to pay the bill. I tried clicking the button and nothing happened. So if I get some guidance on that, I'd get that payment in.
Do you have Venmo or PayPal?
I have both.
Okay, then I can send you the Venmo link for the Sandy Miss Rotary.
Perfect.
Send me the PayPal link. I'd love to do that. I've always said like it's easier to pay it online. So
yeah, okay, got it.
That'd be great. So Jim, jump in there. Appreciate the spill. I have a box that's literally in front of me in my office. I'm in my office right now. There's literally a box right in front of me. It's a ton of paperwork from the VA and whatnot. We do April 12th, as a matter of fact, it's a Friday night at 6 o'clock. We'll be taking care of a veteran and a bunch of different ones on top of it. Trying to figure out how to navigate what you're talking about. It is it's quite the system. It's rather interesting, but we spend a lot of times, in this case, it happens a lot of Marines that come through my establishment, that it's you get the old classic, like, well, I heard if you do this, or this is what it is. Hearing from you right now, it's like, oh, okay, that could be a thing. I didn't know that. Like, great example would be what you were discussing about dying from a service related thing. Your spouse can have the benefits. Like, I've never heard that one. you know, you were saying like spouses going to school. I've heard a little bit about that, but I don't actually know a whole heck of a lot about it. And so in our house here at High Point, we do a lot of work with veterans that it's just like what can we do to help you? And it's myself being a veteran. I'm 90% service connected. I have another gentleman that's 100%, and then I got a bunch of guys at 90, then so on and so forth that are just like, I really don't know exactly what's going on, but how do we make things work? And I'm trying to help other guys who are like, I have no idea how to go to school, and I go, I'm not sure either. So I don't know if this is something that we can really connect on. I assume it is, especially with being in LA County, how to start getting that word out. We've just kind of built a reputation here of being able to be helpful to veterans, and it's all branches, obviously, of what we can and can't do. But you know, I think a lot of it's that woo-woo idea of like, I think I heard this, and you don't really know. And with what you were saying about the veteran thing on your license, yes, that's fantastic, because I remember getting that the month it came out, and it was $11, and I was like, cool, just it says veterans on my ID. You never really do anything else than that. But as a new member, I'm excited to have you here. I don't know if you live somewhat locally.
I live out towards the west side, so pretty much on the opposite side of the county.
Yeah, got it. Yeah, the exact opposite side. Got it. Okay, great. Yeah. Like I said, there's a lot of guys that come through my place that are always asking questions. So you are a fantastic resource of a gentleman that I can harass and really start to like hammer down on that. I'm this is exciting. Like I saw what you're going to be here today, and I went, this is going to be great, because it really just helps out with everything and all these guys that come through here. I'll tell you right now, obviously they're not big on being part of the Rotary. They're like, oh yeah, you know, we heard something about that, but this kind of information I want you to know is going to get out to a couple dozen people that are coming through. There's one sitting right outside my office right now, and it's just this is great. I'm really excited to have this. So I thank Raymond for that, being the guy that he is. I don't have any questions. I just want to sing your praises. That's really all it came down to. But Raymond is so good at questions. So Raymond.
Yeah, appreciate that, Dominic. Yeah, I mean, one thing I'd say is our phone number is 1-877 for LA vets. And so, you know, sometimes you can talk to other veterans and you can get enough information to navigate it successfully. But if you really want to nail it down and talk to an expert, I mean, just reach out to one of our accredited VSOs. You know, if you live out in San Bernardino or Riverside, we don't turn veterans away if they live outside the county. We all, I got plenty of guys that I served with that live, in different counties and different states. So we don't kind of, get like that. But by talking to an accredited VSO, you can get like real definitive answers on how to navigate. And most importantly, when you're filing a claim, that technical nuance, that unless if you're doing it every day, like you're just not going to know.
100%.
Yeah, you might know the form, but you don't know the secondary conditions. You don't know the frequency of symptoms, in order to be rated at a certain percent, all that kind of stuff.
I've been out to 2007, didn't even know how to get a claim in until 2016, and just found out in the last, we'll say 6 months, that there are things called secondary conditions. And PTSD at 70%, they were like, hey, you should really come and do sleep apnea, because out of Johns Hopkins, they said, hey man, PTSD, sleep apnea, that's hand in hand. Didn't know that. Went took a test and said, oh, you have sleep apnea. I do not fit what sleep apnea looks like. And they were like, yep, that's clearly PTSD related. So yeah, no, I've been out there trying to preach that word. I don't know if there's a way. I know we're a brewery, so I don't know if the county will love that idea. But like I said, we have so many veterans that come through here, and I can really rally them to come out and actually listen to an actual expert. And that's something that, the amount of guys I have coming on the 12th, for instance, it's just like, we're just going to have a conversation. And to your point, the nuance of words are very important.
Yeah, I mean, we do that at veteran VFWs and American Legions. Our accredited reps will go out wherever the veterans are and engage. So yeah, something like the 12. We don't care if it's a brewery. I mean, VFWs are kind of like breweries. They're not brewing anything, but they're doing plenty of drinking. So yeah, we don't we go where the veterans and the family members are, alcohol or not. So.
Okay, yeah, like I said, just I'd love to get connected. I know you're on that side. I'm sure you have something on this side. Really, I mean, yeah, there's a guy from the VA just connected with us 3 weeks ago, and I've got a box in here that I'm like, what am I gonna do with all the paperwork? Because we don't know how to fill it out. So to your point, yeah. But absolutely, yeah. I'd love to get you guys out here. I'll obviously connect with you afterwards and just say, what can we do? And then we can work with all those guys. There's, like I said, a dozen plus guys that could at least use that help, and then so on and so forth. There's a VFW just right down the street, and then we always had new guys coming through that are like, wait a minute, how does that work? I've been working this project for probably several years at this point, so I'd love to see that kind of thing expand more and more and become, not that I necessarily need to be the hub, but I like the idea that we have a place that like this Rotary Club has been so fantastic. I mean, at this point, 20 tons of food, multiple bases, and we
Great
keep
mission.
expanding. Like I would love to not only have that mission, but the idea that, to your point, like we're taking care of all these veterans also. I'm really excited about that. And like I said, when Raymond had mentioned it, I said, that's going to be great. This is going to go fantastic. So with that, I don't know, Bella might have a question. I'm just going to keep running my mouth because I get excited about stuff like this. Bella, would you like to say something?
I'm just along with you with singing the praises. I'm not a veteran, but I am very pro-military, so I like doing what we can do as much as we can do. And I know Dominic's a big dreamer, so I support how much you want to feed our active military and then spread to reservists and our 1.2 million veterans. So
Yeah, to that point, like I said, I know there's a lot of benefits, and I just need these guys to take advantage of them because there's so many different ones that they're doing it and they don't even know there's a benefit to it. And I think to myself, man, oh man, if only we can get that information out there. So, like I said, I'm excited. You go ahead, Jim.
Yeah, I don't know if your dad or your mom were veterans, but my dad was a Vietnam veteran, and I tell you, whenever he didn't talk very much about it, but whenever he would talk about his military service or talk about going to the VA, I was just really proud of him as his kid, and like the more benefits that we are connecting veterans to, and the more opportunities that their kids have to access that, just kids just feel proud, for the most part, most kids feel proud of their parents that served and of their service. And so part of it is like helping the veteran and their spouse economically, but it's also helping their kids economically, and then giving them an opportunity to feel the pride from their family member service. So it's kind of an all around kind of thing for me. And I love throwing events for veterans, and their kids attend, and their kids are you can just tell their kids are so proud of them, and then the parents are just they feel proud because their kids are proud of them. You know what I mean? Like, and you see that kind of unfold, and
Right.
it's rewarding.
I love that. Like we're saying, there's so many things I don't know, and I have no problem admitting that.
Same, actually.
And the more I can, the more I can learn, the more I can preach it. I've got the next group of veterans behind me always. So I always tell people there's one more group always coming out, right? My brother-in-law he's a major in the Army, and he's like, well, I don't really understand how this stuff works. And it's like, well, you've done 20 plus years, man. He was enlisted, and then he went at officer, and it's like, you're messed up. Let me help you. And he's got 3 kids. He's got my sister-in-law, and it's just like, hey, let me help you figure out what you can do. And then I can always keep passing that along. I have a very big mouth who likes to talk a lot. So like I said, I think you've joined exactly the right group, Jim, that you're going to have a great outreach with everything going on around us. Because I just love telling everybody about it.
Yeah, I mean, I really like your guys' mission. I mean, Raymond and I went out and got a cup of coffee and breakfast, and he was filling me in on all the great work that you guys do, and what a great mission. And I don't know if you've ever heard of this, but there's a thing called a BDD claim.
Never heard of that.
Yeah, so we can actually do a claim for a service member before they even get out and become a veteran. So we can get everything lined up while they're still in. And so that's something that, as you guys are going out to military installations, I mean, there might be an opportunity for a rep or two from my shop to attend to, and just kind of talk to them and and help them with their BDD claim if they're, months away from getting out. If you're going to be a career military person, you're 16 years in, you're not going to do a BDD claim. I think it's like it has to be 6 months out from your ETS date or whatever. But, if we're out there delivering food and connecting with any service members that are getting out anytime soon, love to just work and set them up, so that they don't have to worry about doing it on their own when they get out.
And that's across the entire country, right?
Yeah, so we're everybody in my shop is accredited through California, and then some are nationally accredited. So our nationally accredited folks can work with veterans from other states, no problem.
Got it. Yeah, I just bring that up because right now my brother-in-law is currently in Germany, but I have traveled to Missouri, DC, Georgia, all these different bases, and I've just met so many Army, Marine, Air Force guys that we still talk, and I'm like, okay, well, let me know what you guys are doing, whatever I can do to help you guys, and if it's one more thing to say, like, hey guys, here's something you could do. These are the kind of guys, especially now in their career, that are like, oh, I'll absolutely do that, and then we'll just keep in contact going. So that's perfect. Good to hear. I'm really happy to hear that. So, all right, I've stolen so much of your time, but I'm looking forward to talking to you more, Jim.
Yeah, nice to meet you both, and I'll watch out for that link to pay my dues, and look forward to being a member and participating and see how we can help support the membership and beyond.
I look forward to it. All right, perfect. Then I'll bug you later. You can stay on if you'd like. Otherwise, it's going to be Bella and I having a conversation about other things that are going on.
Well, he is our member, so he's got to stay.
That's
actually, I just had my American Legion post reach out to me and like, hey, when are you hopping on? So I can't stay this time, but next time I'll hang out.
I look forward to it.
Yeah.
Jim, I look forward to it. I can't wait to talk to you. I'll email you later.
Sounds good. Have a good night.
Bye.
Bye. Bella, do we have reports or anything we need to do?
No, we have a committee meeting at the end of May.
Mm-hmm.
Like trying to figure out how to turn off the